Namaste and greetings. I, Shweta, researcher at IMPRI, Impact and Policy Research Institute, Prabhav एवं नीति अनुसंधान संस्थान नई दिल्ली, extend my warmest welcome to you all to IMPRI Web Policy Talk. We are gathered today for a panel discussion on Population, Health and Interim Union Budget 2024 to 25 as a part of IMPRI's fourth annual series of thematic deliberations and analysis of Interim Union Budget of fiscal year 2024 to 25. This discussion is organized by the IMPRI Center for Human Dignity and Development as a part of IMPRI Web Policy Talk series. I welcome you all to this enlightening deliberation and thank you for tuning into this discussion. The chair for this session is Dr. Devender Singh, Visiting Senior Fellow at IMPRI and Global Studies Program Fellow at University of Freiburg, Germany. Now let me introduce the esteemed gathering. Mr. Arvind Uniji, Visiting Senior Fellow at IMPRI, Mr. Urvashi Prasad ji, Director at Development Monitoring and Evaluation Office, Niti Aayog, Professor Sanghmitra Acharya ji, who is a professor at Center of Social Medicine and Community Health, Jawaharlal Nehru University, New Delhi, Professor Pradeep K. Panda ji, Professor and Dean at School of Public Health, Asian Institute of Public Health, University, Bhubaneswar, and Mr. Abhijit Mukhopadhyay ji, Consulting Economist at the Secretariat. I welcome you all. We look forward to learning from our esteemed gathering. Now, without any further ado, let us start the program. It is my honor and privilege to invite Dr. Devender Singh ji to start the program with the chair's opening remarks. Over to you, sir.
Sir, you are on mute, actually.
Okay, as Shweta said, it's our discussion on the financial year 24-25 budget, which is interim budget. It's not a full-fledged budget in the area of population and health. This is third edition of our talk, and some of the panelists, as I said earlier also that last year also we had a discussion, and Dr. Sachin Gupta is the new part of our family, which we keep discussing on population and health, and we welcome him for this edition, and hopefully we will continue in the coming years also with the knowledge and insights from Dr. Sachin. So I'll be just presenting few slides just to give a context on the topic of the panel discussion. And then we will go to the panelists and hear their views on population health in the interim budget in more details. And later on, once they have made their discussion or overall observation, then we will open it for more probing and question and answer. To start with, why we are discussing population and health. So my argument is here that population dynamics and health, they are very closely interrelated. When we say population dynamics or population, then there are broadly three key characteristics of population. One is in terms of population size and growth. What is the current size, how the growth in the population, overall population number is taking place. And then we also look at how it is organized in terms of age structure and sex structures, like how many men, women in different age groups are there, old, young, children. That has a ramification when we start planning for different population groups, where the focus of our policies and programs should be. And then the third is the location, where these people are residing. So spatial distribution of population. Migration is an important characteristics of population dynamics, uh, and urbanization, where more people are living in rural areas or in urban areas, and what is the back and forth movement of people between rural and urban. As I said, they have a symbiotic relationship. One affects the other and get affected by the other. For example, if the population is growing very much, then it will have impact on the overall budget allocations for the population. It will come down, which could affect different provisions in terms of health services. If the health services are good, like for example, reproductive health services are good, child and nutrition, mother health is good, then it will have effect on a healthy population and could also affect different parameters of population, like for example, stabilizing the population. So it's a back and forth, a two-way relationship between population dynamics and health. Then the next thing is why it is important part of the budget, why we should have a panel discussion on discussing population health in terms of what is being provided or what are different allocations in the budget. Budget is not just a statement of revenue, expenditure, and allocations. It's also a thinking of government. And some people are saying that's because it's an interim budget, it's not a full-fledged budget, just because before it's happening, the elections. My understanding is that this interim budget is more important because it's happening just before the elections. It gives a better understanding how the government is thinking on different policies, programs, and initiatives. In the regular budget, maybe it's the, you can say, push and pull of giving a broader picture, how it's thinking on its policies may be lacking, and that may more be a technical exercise. But here, this could give a better understanding, and let's see how our panelists think about that. So it's kind of vision document about national priorities and policy regimes. Within this context, when we look at the budget in terms of population health, some of the important questions which came to my mind, that is the budget guided by demographic intelligence? Is it responsive to the health needs of people in different age categories, for example, women, young girls, and people living in different locations? And does it lead to prospective planning for the emerging health needs and concerns of the people? My understanding of the budget is that there is a limited use of demographic intelligence in the preparation of the budget, especially in the health sector. We can see that there is a focus on women, but young girls and boys, that focus is missing. And from the demographic perspective, my question is, have we stopped talking about the demographic dividend opportunity? There is no additional allocation for schemes for older persons. Migrants are missing from the budget. There is no discussion. Like during COVID-19, we saw the plight of migrants, hundreds of thousands of migrants. They moved from urban areas to the rural areas. And there was a lot of discussion around at that time that people came to know about their plight, their number, and there's a lot of discussion that we need to have proper assessment of the numbers, their living condition, their working condition. But that has not translated into some sort of attention, focus, or research or policy initiative, and which we can see in the last two budgets also, but in this budget also, we don't see any special focus on migrants. And it does not seem to acknowledge or respond to changes in age structure, location, and issues concerning the population dynamics. But what was heartening to see in this budget was that Finance Minister talked of setting up a high-powered committee on population to consider the challenges of population growth. And the word used in the document is fast population growth and challenges occurring because of that. So the committee will be mandated to make a recommendation to address these challenges comprehensive in relation to the goal of Viksit Bharat, which is supposed to happen by 2047, like in the 100 years since independence. So Arjun was asking that I'm not talking of Viksit Bharat. I have used it in my presentation, but it's a long goal. Like it will happen in 2047. Let's talk about like what is happening currently and whether we are in a position to reach there in sooner than 2047. Why to wait till 2047 if we can do it earlier? Again, that was population dynamics. When we look at health also, the overall impression is that again it's not the focus of the budget. Capital expenditure is the focus of the budget. How we can support the private sector in different sectors, that is the focus of the budget. And also like how greatly we have served the people of India through different schemes. That was the but when we come to the nitty-gritty, like how different things are allocated, or different schemes or programs are allocated within the budget, within the health sector, then we see that it is not happening to the extent that we would like it to happen, and which the government of India's policy documents like National Health Policy 2017 also stipulated that we should have a target of spending 2.5% of our GDP by 2025. And to reach that goal, we should gradually increase our allocation for the health budget. So what happened that when COVID-19 happened, there was suddenly an increment in the budget allocation, and that could be because of and not only because the greater need of resources, but also because there were additional requirements to address the pandemic, like vaccine development or providing equipments or medicines, or mobilizing more volunteers and health workers, or even the budget which was given to the railways to ferry the migrants and other people, that was also included in the budget of the health budget. So it spiked. But at that time also, it reached only 2.1% of the GDP. It did not reach the supposed or the aspirational value of 2.5, which again, compared to the other countries, is not very high. Like it's a modest figure, but we are not reaching that modest figure also. But as I said, once the epidemic is over, it's said that we are returning to the earlier allocation for the health sector. For the health sector this year, it has increased slightly, but when you take care of the inflation, then in actual terms, it is a decrease of around 1%. And overall, when we say it's around 1.9% of the GDP, so it has not reached even 2%. And from the pandemic year, it has gone down. So in this discussion, we will be looking at all these issues. What are the key population characteristics, key health needs and challenges? And what the first section, where when we go to the panelists, we will be, what is your overall impression of the budget? Then in the second, when we go on discussion, we can discuss more like what you have said in your presentation to elaborate on those points. And also, as I said, we gathered last year also. So what we were thinking of the budget last year, and what was your our experience during the whole year? What were the budget estimate and what were the expenditure whether we were able to achieve what we had set out to achieve in the budget in the last year, and what are the emergent priorities in the field of population health, and whether this budget has policies and programs and allocated funds for those programs. And in the end, when we are going to the last, we will be asking like, what any additional thing you could have thought of which should have been addressed in this budget. With this, I'll stop sharing my presentation, and we will go to the panelist, and we will start with Professor Sanghmitra, and I'll request her to make her presentation.
Thank you. Thank you so much, Dr. Devender. It's my extreme pleasure to be here once again, part of this discussion which IMPRI organizes almost every year. And I'll just share my understanding of the budget in terms of population and health as the discussion is on about today. So I have shared the PPT with Arjun, otherwise I can try sharing it also. Yeah, very quickly, I think what I simply want to say is when we are looking at population and health in context of the budget, couple of pointers that I would wish to make for population per se. We can go to the next slide, please. Yeah, what I'm simply trying to say is, can we take a call in terms of how the budget is telling us in terms of the population growth on one hand, and on the other hand, we've been made to believe that this growing numbers also have certain elements in terms of human resource, and we are supposed to reap the demographic dividends also. And a couple of points that I would wish to emphasize in terms of health certainly begin with the infrastructure, personnel as part of the infrastructure, or even otherwise the pharmaceutical industry, which has been kind of given a fairly good emphasis on this, and also the medical education. So if we go to the next slide, please. Next slide, please. Yeah. While we all know, I mean, if we are talking in terms of the absolute figures, there will be an increase in the number. And as per the latest census that we have at our disposal, we see there is a neat increase in terms of absolute numbers vis-a-vis when we are looking at the growth rate. I mean, I would probably, it makes very clear to us that 70s onwards we do see a declining trend, although the trend could be slightly gentle, and then we do see a little faster drop, particularly between 2001 and 11. So next slide, please. If we take this forward in terms of the regional analysis, certainly an aggregate figure gives us one picture, and when we disaggregate, we do have the scenario wherein we'll have some states which have fared better in terms of addressing the concern for population growth versus certain other states. And we see this, and I'm using the research which the PEW Research Center has done, and I'm sharing, in fact, their findings in many ways, which I adhere to as well. We see a very neat picture, which is nothing new. I'm sure we are all familiar with the way the large central Indian states, Hindi-speaking states or Bimaro states, which of course is a taboo term now, have been faring differently as compared to other states. But we do have an option to probably trick it the way that suits us, especially in the light of what Dr. Singh has just said in terms of the transition from to Viksit Bharat. If we want to bring that in, we do have options in terms of how we address the needs of utilizing the demographic dividend, and also pointing out what he's already said for us in terms of what's happening to the young boys and girls, especially when we have more numbers at that age group in our case. So going ahead from there, the other point which I want to bring in through the next slide, Next slide, please. And this is NFH's data again, which PW Center uses. Very distinctly, we see across religious groups, we have a downward trend in TFR that we see for ourselves. So very clearly, the gap could be bigger and smaller. Nevertheless, the trends for sure are downwards. So if this is the scenario that we have in terms of the total fertility rate, we are at the point where we have, roughly two women during her reproductive ages wouldn't want to have more than 2 children. In fact, we're getting to lesser than 2 as well. Next slide, please. Why is it that we have been, we need, I'm trying to understand the genesis of this special committee, which has been suggested very next day, as we see from the newspapers. And I'm also a little quizzical in terms of the usage of the term fast population growth, where when we see the trends don't really seem to be fast if we're talking in terms of the growth rate. When we're seeing the downward trend, we do remain higher in terms of fertility when we compare to countries like China or the USA or many other countries, for sure. But what's important is when we are comparing with our own selves, we see a fairly big change that we see from the 50s to the 90s also, 3.4 to coming down to 2.0. Fairly, we need to be appreciated about it as a nation in that sense. And therefore, also what we just talked about in terms of the demographic dividend, 40% of a population will be aged 25 and more. Even when we picture that in the global scenario, one fifth of the total global population will be, in this age category. And we are aging also. If you look at the aging context of our population, we have kind of increased the share of the aged population, although we still remain lesser than the other countries, the other 2 countries particularly that I'm talking about. So the point I'm therefore making is that in this change that we are seeing vis-a-vis the demographic indicators, there are certain positives which are hidden, which we need to tap. And this is where perhaps we also need to then start thinking about the context of out-migration and also the employment scenario that we may be proposing to absorb this, this set of young people vis-a-vis reaping the demographic dividends. How prepared will be the, what we say, Viksit Bharat in this context becomes very important in terms of assuring what the budget is proposing will actually be able to happen. And I want to bring in the context of migration now. Next slide, please. While we know that we basically are out migrating nation, if I may say so, we do have more people moving out of the country than coming into the country. We might want to point out some specific references at certain time points, but on an average, we are out migrating. What is perhaps important to see is, particularly post-COVID, when we do see influx of urban-ward migration, migration towards metropolitan regions, we also has distress migration because of the pandemic. Dr. Singh has already alluded to it. And we also see the realms of employment being, going off its regimes when it comes to people who had to revert towards their native largely rural, underdeveloped places. It really becomes important to figure out what were the processes, what are the processes of absorbing them back into the fold of their employment as well as employability. So in this context, perhaps it becomes important to take a note of the connects that we might want to draw vis-a-vis the demographic dividend, vis-a-vis the employability and employment scenarios. And we do see there are certain shifts which are visible when it comes to employment. Employment generation has happened in the sectors which are largely low-waged employments as compared to the employments where there could be the wage packets could be higher. In fact, just yesterday, the newspaper talks about the shrinking of the jobs in the IT sector. So one has to probably think about it, and IIMs and IITs not being able to put that context there. So, so if we then take on to how the health scenario, I mean, I was largely trying to come to talk about the demographic related attributes. If we come to the health sector, next slide, please. We would probably feel good that there has been an increase in the allocation, budgetary allocation, but Dr. Singh has already pointed out, while there is an increase in the absolute numbers, from perhaps 86,000 odd crores to something like 98,000 crores if you include Ayush, pharmaceutical, etc., etc. While we do note this as a 4% increase in nominal terms, but we factor in change vis-a-vis inflation, and especially if we compare from the budget estimates of 2023, the increase is fairly minimal. I mean, even less than 3%. So, which appears to be this big may not necessarily be big enough to reach the goals that we've set for ourselves. And I would pick up perhaps some of the schemes and medical education, particularly, to elaborate on this. Very quickly, if we go to the next slide, it becomes very, these are perhaps the two very widely, talked about, utilized, schemes that we have: Pradhan Mantri Swasthya Suraksha Yojana and Ayushman Bharat Health Infrastructure Mission. Now, if we look at these two particularly during pandemic, there are evidences that use of these schemes had very considerably taken a dip. And we all understand pandemic has been one of the very important reasons for letting this happen. But then what's interesting to note is that if you look at the allocations, it's marginally lower than the last year's budgetary estimates. And therefore, what perhaps becomes a challenge is to ensure that the revised estimates, which were there for the last year for these schemes, while they were lower, and if the utilization has to be improvised, how do we actually, what will be the roadmap for enabling us to do that in order to make sure that the access to these schemes, schemes which have been meant to ensure the betterment of the people will actually be able to happen. Just an elaboration on Ayushman Bharat again. Next slide, please. If we can, which was perhaps a pointer in this year's budget, that in this scheme, Ayushman Bharat Pradhan Mantri Jan Arogya Yojana, we'll now have the ASHA workers and the Anganwadi workers who would be included in the. In fact, when I read this, I was actually wondering, probably also believing that these are the workers who should already have been covered by this scheme. To point this at this moment, I thought we've already lapsed in not including them already. If this is when we are going to include. Alternatively, if this is the scheme meant for the BPL population, I would still want to believe that a good number of ASHA workers and Anganwadis would be eligible to be incorporated in this scheme. So, okay, I take this point. So this was something which I thought was important for us to take note of in terms of the schemes, particularly when certain workers were to be included at a time point such as this, which will also increase the requirement in order to ensure that the additional 7.5 million new members, given the average member per household as 5, when we have 1.5 million workers in this cadre. So that was something perhaps I thought we might want to take note of. Similarly, if we go to the National Health Mission budget, we know that it has, next slide please, the budgetary allocation really doesn't seem to have changed much, and here is perhaps the catch. If we will need to improvise on the human resource for health for sure, especially in the light of the enhancements of the institutions, medical education institutions, which has been kind of suggested by the budget. Particularly the point which perhaps is of interest at this moment, while there is a very clear marker that we do have the gap in terms of the human health, human resource, and therefore these institutions, if created, will be able to fill that gap. But something which perhaps needs to be taken on board when it is stipulated that there will be, the committee which will be set up to understand how the public sector hospitals can actually be brought under the realms of non-health ministries and the PSUs in order to bring about or create that human resource for health. Still perhaps needs a roadmap. I am still not able to comprehend why will a sector, how do we see that convergence happening across the sectors in order to feed this requirement? So I think that's something which might be of interest in terms of trying to take this further. And the last point perhaps which I would want to make here at this moment is, in all of this, the next slide please. If we are kind of using enhancement of the infrastructure as one of the very important pegs, and we have experienced faculty shortage in the current institutions that we have, and that's also led to some kind of it has impacted on the quality of education. It has therefore also impacted on what the state envisages, universal health access to everyone. So if the medical institutions, colleges and other centers wherein care as well as education can be sorted out, I think it becomes very important to get back to the last year's budget, wherein the allocations have happened. New nursing colleges have been have got their respective budgetary allocations. They have started, the creation of these institutions has started, but what happens to the already existing cadre? Have they been absorbed in the human health resource requirements? The existing number of professionals at all levels who are available to provide the resource, have they been absorbed or not? If they have, how is this allocation will be viably allocated, disaggregated in terms of this understanding? I would be really interested in getting across. Although we do know that some of these colleges have already, their detailed project reports have been put in place. Fundings have, initial funding has also gone in, and therefore the work is on. But again, the question to me still remains, and I would wish to pose, how do we see the convergence happening across sectors in terms of public hospitals, particularly in the light of when we have created that space for private sector medical care and education? And I'll stop here. Thank you so much. I think I've overshot my time. Thank you so much.
Thank you very much. You have given a broader, like what I was hinting at, you gave the data and a broader context of population dynamics as well as health and issues and challenges and key initiative with this budget. So that's a very good platform to invite Professor Panda to share his views on the overall, his overview of the overall provisions in the budget.
Thank you so much, Dr. Devender ji and IMPRI for this opportunity. I'm delighted to be here for this important panel discussion on budget and population and health. Although we are discussing about health budget, so I would like to first give my takeaway on the overall budget. What is my key takeaway? Then I'll go into the health aspects. So the interim budget 2024-25 emphasizes fiscal consolidation, highlighting that the economy must remain fiscally fit to run the marathon for 2047 to become a developed nation. Fiscal deficit for 2023-24 has been projected to reach 5.8% of GDP and promised to bring it down further by another 70 basis points to 5.1% of GDP in 2024-25. What is more important to flag is that the entire consolidation has been done by correcting revenue expenditure, while capital expenditure has been raised to support growth. One hopes that the newly elected government in May 2024 or so would stick to this path of fiscal consolidation and debt reduction to create fiscal space for any future shocks like COVID-19. So that is my overall general remark on budget. Now I'll come to the health sector specific. Now, allocation to health sector in central government budget in 2024-25 is 0.28% of GDP. What about last year? Allocation to health sector in central government budget in 2023-24 was 0.27% of GDP. So during the last few years, it is less than 0.3% of GDP. Very low indeed. And another indicator is out of the total central government expenditure, the share of health sector is 1.9%. And the share of education sector is 2.5%. So although we are talking about health, we need to also bring in education, because education and health are two important dimensions of human development to enhance human capability. So in both these sectors, actually, the allocation is pretty low, and the share out of the total expenditure also pretty low, 1.9% for health and 2.5% out of the total expenditure for education. So that is one. Now, already Professor Sanghmitra talked about few figures, but when we talk about health, of course, we take Department of Health and Family Welfare and Department of Health Research. So in nominal term, there has been an increase of 12.6% in nominal term from the revised 2023-24 to budget 2024-25. And as Professor Sanghmitra also told, and I also noted, so there has been an overall focus on Pradhan Mantri Ayushman Bharat and Health Infrastructure Mission. So the revised estimate for 2023-24 was 2,300 crore, and in the 2024-25 budget estimate, it is 4,575 crore. So there has been a 99% increase. But we'll come back to this. Actually, there is a problem here. Second indicator is that human resources for health and medical education. If you compare the revised estimate of last year and budget estimate of this year, it has gone 230% increase from 1,519 crore. That is the revised estimate for 23-24, and budget estimate this year is 5,016 crore. So it looks like there is a huge increase, but there is again a problem when we discuss about the revised expenditure of last year and what it was budgeted. So there is a problem. Just to cite one example, for example, okay, at this point, already we saw that there is a substantial increase in human resources for health and medical education. If you compare budget estimate of last year and, revised estimate of last year and budget estimate of this year. But if you look at last year, the budget estimate and revised estimate, 2023-24, the budget estimate was 6,500 crore for human resources of health and medical education. But the revised estimate, it's only 1,520. Very little is utilized. So I hope that in this budget, as promised, the high allocation all should be utilized to have human resources for health and medical education. The same is true for Pradhan Mantri Ayushman Bharat Health Infrastructure Mission. The budget estimate last year was 4,524 crore, but the revised estimate last year again is 2,424 crore. Again, 50% less utilization. And for Ayushman Bharat PMJ, Prime Minister's Jan Arogya Yojana, it is much better. Substantial money has been utilized. For example, the budget estimate last year was 7,200 crore, and the revised estimate is 6,800 crore. Substantially much better utilization in this case. Similarly, National AIDS and STD Control Program. If you see last year, budget estimate, it was 3,080 crores. And what actually is the revised estimate? 2,420 crores. Substantial amount is not utilized again. So that is a huge problem about the budget estimate and the revised estimate. So what could be the reasons we can discuss? But one possibility is that maybe there is inefficiency in the administration, or there may be some absorptive, capacity is low in the health sector. So there may be some weaknesses in the health systems. Why there is so much of unspent money when it is allocated? Already the allocation is low and we are not able to utilize that. So that is another point. Now, some other points is that, as Professor Sanghmitra also told, I also believe that the Ayushman Bharat scheme is extended to cover all ASHA workers, Anganwadi workers, and helpers. I think it is a commendable step, good initiative. It will expand the universal health coverage. It will provide financial risk protection against illness for frontline healthcare workers. Of course, we know that out of all these workers, many would already have been covered. Those who are below the poverty line. We don't know the number. But still, already we know about the missing middle. Yeah. There may be a lot of these frontline workers who are above the poverty line. At least they are covered. That is a good thing. Financial risk protection is given to them. So I think this is a welcome move. Now, a boost to children's nutrition and address strengthening Anganwadi centers under Saksham Anganwadi and Poshan 2.0, which will provide improved nutrition delivery, early childhood care, and development. Only good thing I see in this budget this time is that, unlike the earlier budgets, the age group 0 to 3 years is covered. Very important. Earlier, 4 years and above were covered, not 0 to 3 years. So this time it is all inclusive. We know about the importance of first 1,000. So that is a good thing, although there are still many challenges in implementation. Okay. Now, new medical colleges will be added to cater to the shortage of doctors. So we know that there are lots of shortages in medical offices as well as specialist doctors, and specifically in the rural areas. So setting up more medical colleges obviously will help. It is a good move. But one issue is that quality of education should not be compromised. We need more people, more educating, but we need to ensure quality of education to all these new people who will be graduating from these new medical colleges. Okay. Then cervical cancer. Vaccination for girls 9 to 14 years for prevention of cervical cancer. I think this is also a good move. Cervical cancer is the second most type of cancer for women in India. Most common, second most common among women in India. But globally, if you see, it is fourth in order. but India, it is second most important. So this is a vital shift towards preventive healthcare, aiming to safeguard the health of the future generations. So vaccination to prevent cervical cancer are likely to become cheaper as well. We have to see, because of the new initiative, vaccines are likely to be cheaper. Otherwise, currently it is available in the private sector and the cost is huge. Okay, as you know. Then several schemes for maternal and child health care will be brought under one comprehensive program for synergy in implementation. We have been talking about this, about convergence. So definitely it will help. But how it will be done, what are the roadmap, we don't know. But theoretically, it is a good move. Convergence. Instead of duplicating the various efforts, bring all the programs together and make it one comprehensive program. So it will provide synergy in implementation. Then UWIN platform for managing immunization and intensified efforts of Mission Indradhanush to be rolled out throughout the country. So that is another initiative. So two aspects actually that are not directly related to health, but I believe that may help the health sector indirectly. Two aspects. Allocation to production linked incentive, PLI scheme increase. So some of the pharmaceutical companies will benefit from these PLI schemes. Second, new scheme of biomanufacturing and biofoundry to be launched to provide environmental friendly alternatives such as biodegradable polymers, bioplastics, biopharmaceuticals, and bioagri. So this will also help indirectly the health sector. So I'll stop here. Thank you.
Thank you very much, Professor Panda. Now, the envelope is getting bigger and more details are coming. So I hope later on it will lead to a lively discussion. Now I will invite Abhijit to share his views overall on the overall budget, what he thinks from the perspective of an economist, but also broadly what he thinks like the provisions on health. Abhijit, you there?
Yeah, I'm here. I'm very much here.
Okay.
I'm very much here. What did you think, that I will run away?
No, I could not see on the screen because only few pages were visible.
No, I'm listening to everything because, it is very, from the experts, you get a little bit detail. As you said, that I am not health expert. I am the economist. Yes, I do a little bit of, I am into the policy space. So, of course, I have to do a little bit of health here and there. But yes, there is always the perspective that. But anyway, let me formally start, and then and then say hi to everyone in the panel first, because I was fidgeting around with my setting in the beginning when everybody was exchanging niceties, and then I was doing some nonsense there. Then that is why I missed out. So good evening and hi to everybody, and whoever. I think you are in a different zone. So whatever is the time. So hi for that. And first of all, let me start by thanking IMPRI and Dr. Arjun for inviting me in this annual discussion. And of course, it goes without saying that this is also my rare opportunity to, meet Devender. Of course, it has become an annual meet with Devender, though virtually. I hope when he comes back, he calls me sometime. But anyway, let us come, straight away to the, what Professor Panda was trying to say, that, possibly, yes, I would say that, the government perspective, if we look at the budget speech by Finance Minister, then of course, that is the perspective. The way I see it, I am not being critical or anything. I am not putting any value judgment in the first itself. But it seems, the budget speech, from the budget speech, that after 2 years of spending under the, what we can call duress of pandemic, and some heads, particularly health, money needed to be spent. There was no other option. So obviously, all those fiscal deficit targets under that Fiscal Responsibility and Budgetary Management Act, all those gone out of the window, for a toss. So now I think the overarching, I would say that overarching intention of this budget was to get back into the FRBM track. Yes, I know there are certain kind of compulsions also, primary being a lot of factors, but primary being, your credit rating will might have get downgraded, all these S&P and, that all other kind of, international credit agency. So, and there are a lot of different kind of talks about those debates. I'm not getting there. So basically, because of that, there has been cutback. It is as simple as that. There has been cutback in allocations. So the numbers about, budgetary allocation under different heads, including health, but it's a running, I have looked at the budget data, broadly under the expenditure profile and other kind of things. So it is a running theme that ultimately budgetary allocation has generally been cut in all kinds of different kind of heads. So, this should be contextualized and viewed through this entire fiscal consolidation lens. The fiscal consolidation, which actually happened in this interim budget. Yes, as Devender started by saying that but it's a convention, it's not a rule. That interim budget, generally speaking, before the election, interim budget, no major measures are announced, as a courtesy to the entire process, what we can call the democratic process or something like that. But that does not mean that it could not be broken. But that also does not mean that, under the shield of this convention that you start cutting down. So because, I think that convention is not the real reason. Fiscal consolidation is the real reason behind this. I am not repeating that whatever Professor Sanghmitra and Professor Panda also have given that this thing, that basically, that ultimately there has been increase of around 12,245 crore over the last year's budget, which actually include both Ministry of Ayush and Pharmaceuticals, because the minister Mansukh Mandavia holds both the portfolios, incidentally. So, or maybe, not pharmaceutical, sorry, that chemical also he holds, I think. Now, it is in nominal terms, it is a more than 14% rise. So, it looks very hunky-dory there. But if you consider this with the budget 2023 estimates, then it is somewhere around very, very moderate at 2.6%. And it does not even cover the, the inflationary figure. The current CPI, yes, whenever it is convenient, we generally, and not only this government, even earlier government used to do that whenever it is convenient, you just say wholesale price index, and whenever it is convenient, you say consumer price index. So now, the inconvenient price index now is actually consumer price index, which is actually hovering at very, very close towards the December figure came in, it is very, very close towards the 6%. So obviously, this is not even, if we look at the budget estimates of 2023 and then we somehow this thing, then ultimately, it comes down to something around 2.6%. As once again, it's been mentioned, the National Health Policy 2017, it made a roadmap saying that 2.5% of GDP, Devender also mentioned that in the very beginning, but that was the general, that 2.5% of the general government, that includes both union and state governments, all of them. And then this should be achieved by not even end of 25, it is actually the end of financial year 24-25, which means 2025 March, 31st March, by which, and all of us actually, we really doubt, already Professor Sanghmitra, in fact, very clearly said that also. I could manage to find a PIB release, and which actually says that during the peak of the pandemic, it was somewhere around 2.1%. But GDP grew well last year and expected to grow well this current year also. Forget about, even if I forget about whatever is happening in the next financial year. But even then, of course, it cannot be 2.1%. It has fallen down. So obviously, there is very little chance that that entire target, national health policy target of 2.5% will be fulfilled in next 1 year or so. It's an uphill task, and not an uphill task. Personally, if you ask me, I'll say it's impossible. It's not, but then that should increase. One of the major agenda we always used to, whenever in campus, we always used to say that it should be somewhere around 4-5%. But forget about that. Government itself put in a national health policy which said that it should be 2.5% by the end of financial year 24-25. So we can always say that let us first fulfill that. So that's an important point to figure out. And related thing is that we are not yet into the government budget. If we look at the last 5-7 years budget, we haven't seen that sustained, prolonged kind of increase, which will express some amount of intent, I would say, that to fulfill that kind of a target. For example, in drinking water, a lot of money has been pumped in the last couple of years in Jal Jeevan Mission. That has got, if we look at a very single point social welfare scheme under the water or something like that, then Jal Jeevan Mission will be that. Even earlier, which was done to the Swachh Bharat, it became the flagship. A lot of money got pumped in. Here we are talking about allocation. The utilization and implementation part, I'm coming just a few minutes later. Now, those kind of sustained, prolonged increase in allocations and actual spending also, that is yet to happen, in the I would say in the health allocation and health actual spending also. And of course, that point have also come about, that there are Ayushman Bharat and then Pradhan Mantri Swasth Suraksha Yojana, PMSSY. Those have been very, and it is very surprising also to me, personally speaking, not being an economist, but still, as somebody interested in the health economics part of it, and then there was very less utilization even within the pandemic period. And because of that, probably, the budget allocations are now a little bit lower on the lower side. Now, in the longer term, if we have to have a positive change in direction, then this tendency needs to be corrected, because you can't forget about developed status, forget about, because, for example, what I am trying to say is that developed status will not come out of air. So developed status means that your per capita income has to grow, and where are we? Then if we look at the World Bank figures, we have just crossed in per capita income level, we have just barely crossed the low income level, and we have just got into the the medium. The medium, we are in the absolutely just in the lowest bracket, of the medium band as far as World Bank data is concerned. Now, lowering allocations in health insurance schemes like Ayushman Bharat due to low utilization, it's a one way of looking at future course of action. I'm not saying that it should be done or it shouldn't be done. Once again, there will be some budgetary considerations. I'm not getting into that. But what I am trying to say, there may be, if the utilization is not as much there, then there may be a room for some kind of a relook into the entire, this kind of insurance-based kind of health schemes, where, some critics actually say that finally it results into, cash flows to the private insurance company and private hospitals. So instead of probably bolstering the entire health infrastructure, why not, spending money into the into creating, let's say, smaller rural health centers, as much as can be done, within the limited and constant means. So that can be another way of looking at it. Here, of course, here, in fact, I would say that that Asha and Anganwadi workers in Ayushman Bharat is heartening. But I agree with Professor Sanghmitra that, it was a bit surprising. And for me, simply because of the fact that all of them should have been part of Ayushman Bharat from the beginning, even earlier. I was also a little bit surprised to see that they were not a part of it. Now, during pandemic also, of course, for obvious reasons, and there was no other way of doing it also. So different ministries and different PSUs were pulling all kinds of funds and everything to, healthcare infrastructure for the broader public good kind of a thing. Now, if that, taking that essence, probably the entire budget in the entire budget speech and also in the allocation kind of if we look at the composition of the allocation, I would rather say, then obviously, there is some amount of, I would say, intent, some amount of intent shown to upgrade the hospitals and the institutions to, upgrading the hospitals to medical colleges, and then even with the medical colleges and the hospital, then consolidate all this public, this thing. The intent is shown. I don't know how one has to look very closely on these developments, but this has the potential to add more public hospitals. If that happens, I'll be very happy. I am all for it. But budgetary allocation hasn't come. The caveat is that the budgetary allocation hasn't come, but the only intent has come in this interim budget. But anyway, for the timing, I am also happy with the intent, for the timing. Anecdotally, yes. Anecdotally, I think here we have an esteemed doctor in our panel. He will share his own experiences. But anecdotally, whatever little interaction I had, and then, from some of the reports, newspaper reports and media reports I have seen, that there is an acute shortage of doctors and health professionals in the newly built hospitals particularly, and the medical college, all those medical institutions also. For example, and some of these newly erected AIMS, they have huge shortage of doctors. Forget about, and it is not, and I am not saying that it is generally the problem of the central government, of the union government sponsored kind of schemes. It is equally problematic things in the state government level also. At some of the state hospitals, they operate, a huge building. Maybe, some amount of infrastructure also, which is not otherwise available in other kind of government hospitals, but operating with 3 doctors and probably, 12 medical staffs. So these kind of, these are all very common kind of phenomenon which are actually happening across the country. The buildings are coming out, the infrastructure are coming out, but then, this is not happening. Actual health spending marginally, somehow marginally exceeded budget allocations for consecutive 2 years in the pre-pandemic phase. Starting from, if we start from 2016 and 17, then it fell short of allocation in the next 2 years. That is the most surprising part, which everybody was talking about. But, that is the surprising part. Then let me tell you also, I was doing something about the social sector. Health is still better because, because of compulsion, because of pandemic, whatever happened during those 2 years, at least you had surplus 2 years and huge surplus. But in education and pathetic situation is in social welfare. Whatever little money is coming into these, under these heads, those are not getting spent. And, for health, for the sake of the current topic, then if we could talk about health, surprisingly, this is in 22-23, 15.1% of budget allocations were unspent. In 23-24, 10.6% of budget allocations were unspent. So, this is something which needs to be tackled, this is something definitely needs to be corrected. Whatever is the budget allocation, ideally should be utilized fully in a country like ours. And with this kind of ambition that you want to become developed, though I have my own reservation about it, but, if you have that ambition, then this should be the, whatever money is coming, that should be properly utilized. Of course, it is not the sole responsibility of the central government. That is, health is a state subject ultimately. So bulk of the responsibility to utilize funds fully lies with the state governments also. But union government is not out of it also. Union government also has to somehow push this, at whatever level they can. Probably I am, just at the in I don't want to take much time, but I am reiterating that entire aging population point which I made last year. This is not in focus for simply because of the reason that demographic dividend is something that people are more interested in discussing, or at least, it was very fashionable for the past, how many years, God knows, since I'm hearing this term since 2015-16. And now it has, yes, correct. It has started going down simply because of the fact that that dividend is probably we are losing it. That is also there. If we are not creating enough employment, then we'll be losing it. But I am going to the other spectrum. India's 60+ population, according to some estimates, I don't know how authentic they are. I was just trying to figure it out, and then some estimates are saying 60+ population is going to be 15% of total population by 2036. And when we talk about this entire Amrit Kal or whatever you call it, and after the end of it, by 2050, it will be doubled from the current level, somewhere around 21% of total population, which is very, very significant. And then I would say, one may always argue that, of course, this will happen, let's say, even if we take 2036, so it is still somewhere around 12 years down the line or something like that. But I think that there should be a continuous stream of allocation, budget allocations for schemes relevant to this population, so that a legacy, so that a trend is set. And the schemes like what I am trying to say, the best example would be CGHS. I was checking just during while browsing through, CGHS allocation has marginally come down. So which should not be so. That is the that in a way, if I call it, if I may say so, Amrit Kal will see a demographic reversal of the current situation. So demographic dividend will be completely lost. Once the Amrit Kal is over, your demographic dividend will definitely become your demographic burden. That is going to happen, whether we like it or not. That is definitely going to happen. More than often, we only talk about GDP. But I think this is also one of the important issue. And definitely, the last point that I will make, that any discussion of population in India today should start with population census. Yes, I agree to the point that, why to make a committee, fast population, it is not fast. Definitely it is not fast. That fertility rate has fallen down. So, it is a broader narrative with which actually you are going, and it is unscientific totally. But let us first start with population census. It was supposed to be done on 2021. It should have been started by the end of 2020. Okay, fine. Pandemic was there, 2021. Serious, second stage of the pandemic was there, understood. But everything else is happening. Why we couldn't do it in 2022 or even 2023? 2023 is gone. Now we are in 2024. Everything can happen, but population cannot happen. Why? Because, why I am saying so. But now is the high time. Why I am saying so? Because any social welfare scheme, including all kind of health schemes also, they require updated stratified population data for implementation. Where are you going to spend the money demographically? Where are you going to, allot your money even within a state, across the states, even within one state also? So practically every government, not only the union government, even the state government officials are using outdated data for such, for such implementation. This should stop. Starting the process of population census should be the starting, in the top priority list, I would say. This should be the number one priority as far as anything related to population goes. We need a census right now. That's it. Anyway, I'll just, stop here.
Yeah, the census is very important, and already February, we are in February. It means this is not happening in 2024 also.
Yeah.
Because the first exercise, the first enumeration happens in February, then the second enumeration starts in April or something.
Absolutely.
So that will be the election time. So it seems like it will be postponed further to 2025. So thank you very much, Abhijit. Are you looking nice and healthy? So good to see you. Now I'll go to Dr. Sachin for his overview of the budget, plus some of the points which Abhijit also raised and came out in other presentation also, like a perspective of the practicing doctor as well as in the development sector. So how do you see the budget and the requirement and challenges?
So, first and foremost, thank you so much, IMPRI, for having me here. And Devender ji, it's a pleasure to be on this panel. You mentioned that I missed the previous years, but I'm here on this panel. And it is fabulous and fantastic to actually learn people's point of view. I mean, starting from Professor Sanghmitra, then Professor Panda ji, and then, of course, Abhijit talking about it. I definitely won't go deep into I won't go deep into the analysis and the way everybody has put in their points because I've taken a deep dive into the allocations, the expenditures, the past year's allocation, what's now. But as you rightly mentioned, basically being into the space of public health and working with the not-for-profit organization, I would probably bring in the hat and the prism of what we actually experience in the field and how the current budget allocations address those kind of challenges, right? So I must tell you that from that perspective, if you ask me, I'm kind of tempted to say it's in the right direction, the kind of budget, simply because the intent is there, the intention is there, and practically looking at the challenges at hand at the field level is what the government has tried to address. And kudos to that, to be very honest. Of course, there will be challenges. There is no perfect allocation, or as people say, health is a state of mind, and there never is a situation where mental, physical, physiological, and spiritual health is possible. And Professor Sanghmitra would agree to me because he is in the community medicine department of prevention and social medicine. We have a definition for health, and it's a dream state for everyone. Nobody, if you go by the definition, is healthy, right? So similarly, I mean, any attempt is not going to be 100% perfect, but we have to look at the intent and look at the intention of this, and I'm happy with that direction. First and foremost, let me just get you the experience of the pandemic, and we were right there in the field working with the government, and we did mention that health is a state subject. So a lot of implementation, a lot of work that happened at the state level kind of falls into the ambit and the purview of the state government. And of course, the central government does help them with the fiscal allocation and the direction of SOPs and guidelines and everything for them to make that easier. Just an example, during the pandemic, the first responders were the frontline workers in the villages, right? The ASHAs, the ANMs, the Anganwadis. So this move of getting the frontline workers in the ambit of the health insurance, I feel is brilliant, because while we talk about below poverty line and above poverty line, but these are the frontline workers who actually bore the brunt of engaging with the people and giving them this coverage of health insurance, irrespective of their fiscal status, is a good way of not only appreciating the work they have done, but second thing is recognizing their contributions towards addressing the pandemic that we did. And third thing, and all of them as a woman force, giving them the fillip to work harder and contribute even deeper than what they are doing. I personally felt it's a good thing. It actually gives a lot of morale boosting to the people who are on the front lines, right? Actually engaging with the patient. And this is the experience of the pandemic. So that is one good thing. Another data that keeps coming out is that we've been doing pretty well across NFHS 4 and NFHS 5. Our maternal mortality ratios are coming down, and infant mortality ratios are coming down. The neonatal mortality is a kind of a little bit stagnant, but we have shown some improvement. So bringing those MNCH or RCH programs under one roof for better efficiency and collaborations amongst different verticals or different programs to give a larger work for what we do is, again, I feel from the practical point of view, a good kind of approach. Even when we talked about Poshan Abhiyan 2 and then, of course, the Anganwadi areas to bring in together, it is also looking at, the age of between 0 to 6 for early childhood development and, of course, the health of the kids. So that, again, is consolidation of fund and consolidation of the human resources that work towards a common denominator of population, primarily at the field level. So that seems to be a very good approach. And when we as public health experts, or I wouldn't call myself an expert, but public health student, when we work and implement programs, we always come across those building blocks of health systems. And we know that HR is an important aspect, and a capacitated human resource is a very important aspect of managing the healthcare system of the country. Somebody did mention about a lack of HR at the field level, and that frankly is a reality. It is a challenge. But what I'm happy about is there is an intent of addressing that challenge. And we in certain states we've been working, and we know there is a dearth of specialist doctors, super specialists, pathologists, microbiologists, anesthesiologists, and of course surgeons, gynecologists. All this at the last mile, if available, it's certainly going to contribute towards reduction of maternal mortality, infant mortality, having more surgeries, having people getting immediate therapeutic care. So by setting up funds for developing medical colleges at the district level, where let's say a district hospital which is currently there to be upgraded into a medical college is something where you are likely to have additional HR. Of course, the challenge is to have good quality education for making them reach to the level where they'll be able to provide efficient kind of regimens to the people. But what it does allow is at the district level, you will have people with super specialty and specialty available to provide those kind of medical care to the population. And that aspect of lack of critical care and tertiary care even at the district hospital and some of the districts which are not urbanized or not the state headquarters, the pandemic actually amplified the need of such kind of approach. And I think this is I feel is good. Okay, so I'm going to just wear a positive hat of health and try to connect it with the budgets. Of course, another aspect that came to the budget was that there was the appreciation of the fact that there are a lot of non-health determinants which actually also cause a lot of health issues, right? So there is a special kind of look-in that has happened for non-health determinants, like you're talking about the climate, you're talking about solarization, you're talking about reduction of pollutants, because that is going to contribute very heavily towards respiratory care, infectious diseases, and of course your climate change can contribute heavily. So some allocation towards addressing those kind of green fuel, reducing the carbon emission, that ultimately also contributes towards the positive health of the population. So all in all, while we do appreciate the fact that there are challenges and may not have covered everything, but the intent and the direction seems pretty good. That is what probably I'm pretty happy about. And there was a talk about allocation and consumption, or let's say the opportunity or the ability for the states to absorb those budgets. I want to say that yes, our experience does say that sometimes at the local level or at the state levels, there is there is no lack of intention even at the state level. Sometimes the capacity to absorb those allocation of budgets purely because of the lack of the concerned, relevant, capacitated, educated, and skilled HR, which will be able to absorb those kind of funds of the budget, could be a challenge. But I think that also is getting addressed. And we, as development sector partners who work very closely with the government, we are not, we are seized with that issue as well. We will try and suggest how exactly that can be done as well. So I'll stop here. I'll not go deep into the percentages and numbers and the kind of stuff, but I wanted to wear a hat of a hardcore public health person and somebody who works in the space along with the government. Thank you so much.
Dr. Sachin, thank you very much. No, it's good to highlight the positives which are there in the budget as well as policies, because ultimately what we are talking about the health of the people, or well-being of the people. So through whatever mechanism, or whether it's state government, central government, how it comes, we should appreciate and applaud that. And additional point from the other speakers you brought it, especially the net zero, the environment, and that which has been highlighted in this budget also. Prime Minister highlighted today also in the energy summit, and where he's kind of giving more details on what the intent and different initiatives of his government are.
Right.
And he's inviting people to invest more in cleaner energy, and like as you said, solar especially has been mentioned in the budget. So no, we need to highlight, and thank you very much for bringing that those aspects to the discussion.
Thank you.
The problem is that we have taken a lot of time in our presentations, so we are not left with too much time. What I'll say, you have listened to each other. If you want to make any additional observation regarding something which you said and you wanted to highlight further, or if you heard somebody, the other panelist, and you want to comment on that, so you can start with that. And I think Professor Panda is eager to make some points, so I'll give the floor to him. Start
Okay,
with.
thank you. One point is that as I discussed in my presentation, for some of the important aspects, there has been a substantial increase in the allocation. For example, human resources for health and medical education, 230% increase. And the quantum of budget in 2024-25 is good, 5,016 crores. But hope that this amount will be utilized in the coming year. Similarly, Pradhan Mantri Ayushman Bharat Health Infrastructure Mission, there is a 99% increase in the allocation compared to the revised estimate of last year and to the present. And in 2024-25 budget, the allocation is 4,575 crores. Good money. Hope that again this money should be utilized in the coming year. My only concern is about Prime Minister's Jan Arogya Yojana. Although there has been an extension of this scheme to ASHA and Anganwadi worker and helper, and we don't know the numbers, but the increase in allocation is 10.3%, only 10% increase. So I doubt whether the allocation is sufficient to cover the insurance for all these, frontline workers for the secondary and tertiary care. So it looks a bit difficult unless in the final budget there is more increase in the allocation. The intention is good, but allocation here is somewhat looks like less. That was my comment. And because time is less, you want to combine that, like your last point, you were telling that tell one thing about what you like in the budget and what, that also we should go ahead now.
Yes, please. Yes, please.
Okay, so I'll complete my presentation that way. So now, one thing is that if I would like to identify one thing that I would have seen in this budget. As I told you, allocation to the health sector in the central government budget is, for the last few years, it is 0.3% of GDP. So I would like to have seen an allocation of at least 0.5% of GDP in this budget and gradually rise to 1% of GDP in the following years. And if I would pick one thing which one should keep an eye on from this budget, that the allocation to key programs are not cut in the final budget in July 2020. So that is to watch. Thank you.
Abhijit, you want to comment on other panelists? You want to highlight any other your own point?
Nothing much. But then, just for the record, since we are discussing and then, it is recorded. So just for the record, I know this will not happen and this is difficult, I'm no more, in my 20s, so that, I'll say that, the kind of things we used to say that shiksha pe kitna kharcha ho, budget ka 10वां हिस्सा ho. So I am not saying that, but then my point is that, but at least the point should be always recorded. But from that kind of a sense, I would say universal healthcare. If one thing you have to say, then we should look forward. If we want to become developed, instead of an insurance-based, a very essentially American kind of a model, why can't we, look forward? I'm not saying do it now in the next couple of years or something like that. If we can look till 2047 at this point of time, why can't we see till, let's say, 2034? In the 10 years, we are going to achieve this much. This much area, we can cover this much area for universal healthcare instead of, providing this kind of insurance based, the basis of which is actually medical insurance. And even I believe, but anyway, one can differ. I respect everybody's opinion, but then I believe that, it does not create enough infrastructure which otherwise a universal healthcare based kind of a vision will create. So I would wish for that.
Thank you. Dr. Sachin, want to add something?
Yeah, I mean, looking at the urbanization that's happening at the rate that we have, I think a few people estimated by 2050, I think 60% of our country would be urbanized. And right now, maybe we are 33, 34% urbanized. So maybe looking at that, and then, of course, the changing climatic conditions and the pressure the climate is going to put on the kind of population. Maybe, going forward, or maybe a specific kind of some interventions, budgetary allocations to address urban health, looking at sharpening of, let's say, diagnostic infrastructure, so that we are obviously, the government is doing enough, but maybe a specific channelized kind of way of looking at it in a very channelized way, or let's say in a very specific way, because this is going to help us address future pandemics, and of course take care of climate change, which is going to impact health in a longer term, right? So it's urban health, diagnostics, climate health, and of course, we have issues related to probably antimicrobial resistance and those areas where we can specifically look at, because these are large looming public health challenges, not just for the country but for the globe itself, and we are moving towards those challenges, and we should be prepared right away than when actually we hit that pause button. That would be the way I would look at it.
Thank you, Sachin. Professor Acharya?
Sorry, I'm just trying to unmute myself. Thank you. Thank you so much, Dr. Devin. I have a couple of observations to make. And to begin with, as Dr. Sachin said, the intent is there, but how do we actualize that intent perhaps becomes very important, because I'm sure we'll all agree that we are still nowhere very close to the ideal government spending of 2.5% of the GDP on health. Now, that being what it is, and the health policy also informing us to be able to kind of achieve it kind of by 2025, I think there will be certain things which we would want to think across. And keeping that in mind, if I have to kind of pointedly think what is happening in the budget, I would probably take the vantage point of how the budgetary allocation for pharmaceuticals particularly has been, in fact, in this year's budget more than the whole Ayush ministry for that matter. And probably it is based on the experience of the pandemic and the requirements for adhering or being able to show that preparedness for any kind of health emergency. And therefore, the focus which is there on the self-reliance in the pharmaceuticals.
Look,
There is
looks
a
like
problem.
we lost Professor Acharya. Connection might be a difficulty. In the meantime,
Lost the connection.
yeah.
Sir, JNU, that is it.
In the meantime, can I ask, like, there is one question from Anshula that anybody who wants to respond to that. Does the interim budget offer us anything in terms of understanding a health in all policies approach? Are we able to gauge efforts to address social determinants of health from the interim budget in addition to nutrition and environment as mentioned? So anybody who wants to take, Dr. Panda, Dr. Sachin, Abhijit.
I think it has been not exclusively health in all policies. If you look at the exact content of health in all policies, but if you bringing various aspects, as Dr. Sachin discussed and other panelists also discussed, actually to some extent it is there. For example, climate change. There is an effect on health. Okay, many environmental aspects, solar rooftop, and and also I discussed about some of the other aspects. There also indirectly it is there. For example, this.
You take the wash schemes, you take the nutrition scheme.
The biomanufacturing, then biofoundry, then alternatives to biodegradable polymers, bioplastics.
Yeah.
All these have actually impact, including even education.
Jal Jeevan Mission, clean water is one of the key requirements.
To some extent, it is there, but not exactly to the extent what health in all policies mean. It should have been much more.
Much.
Right.
I would just add that explicitly it is not there. So the kind of development model we have, that entire GDP-centric development model, it will bring in some amount of pollution, some amount of byproducts, which will be detrimental to the entire, I would say, not only climate, generally wherever you live, the entire air, water, whatever the basic needs human beings have, they all pollute. We are seeing everything from that perspective. So that way, if we see that everything, somewhere is connected to health, that is true. That I agree. That I agree with Professor Panda that everywhere it is there. But from the interim budget, but to be fair, interim budget is not the space where actually you can find these, since this bunch of people where we are sitting are interested in health, so we will say health. Some people will say education. Some people will come up with some other parameter. So, but then yes, the all-encompassing general observation will be that let us not only talk about GDP, let us talk about all kinds of social indicators also, which has gone completely out of fashion. So let us talk about health, let us talk about education, let us talk about social welfare, let us talk about housing also. Why not? So much paragraphs, so many paragraphs were utilized in the budget speech itself by Honorable Finance Minister. So why can't we, see everything in this entire range of indicators also?
Sorry, Dr. Devend, I kind of
Yeah.
got disconnected because of some issue in the connectivity. So I just wanted, if you could give me a couple of minutes, I just thought I'll place a couple of my observations too, if that's okay.
Sure.
I know we're running short of time, but very quickly, I think I started on a note that there has been the infusion in the pharmaceutical industry for reasons obvious and coming out of the pandemic. The other point, perhaps, which I would want to make, particularly in this slide, is also when we are talking of this year's budget, what hasn't really come out very clearly, the elderly population has been mentioned already. The mental health infrastructure perhaps still needs a lot more than what we may have kind of squeezed out from various sectors wherein there is convergence. But otherwise, I think a lot, both physical and human infrastructure, which needs to be taken on board to address mental health. And it connects directly with the reproductive health, I would say, particularly the postpartum mental health conditions that women have been experiencing, but the discourse has not taken it on board. That was one thing I wanted to point out. The other was when we are talking about non-health, quote unquote, determinants of health itself, I think previous couple of budgetary years have seen strong allocations in the sector of sanitation and drinking water, particularly if we go back to the SBM. I think that is what is needed again when we are talking about the sector such as health, for simple reason that it connects with almost all other indicators, and that's where perhaps housing becomes equally important. The place of residence, the structures in which we live remain very, very important, and therefore the last point that I would want to bring on board again and reiterate is while we are infusing the medical education infrastructure by way of creating these hospices all over again, we must take on board what is happening to the existing human resource, which is waiting to be employed. So in some kind of convergence, which I think again feeds into what the budgetary allocations are talking about. How do we factor in those who are awaiting being employed into the health and be part of the health resource segment? These were a couple of points I thought I would bring in, at least when we've already shot over the time that has been given to us. So
Yeah.
I'll stop.
The good thing is that the full budget will be available in July, and we will meet very quickly. And whatever is left unsaid now, and whatever our experience will be in the intervening time, maybe in July and August, whenever the new budget is there, we will reflect back what we said today, and also the proposals which will be there in the new budget. So just I'll go back to my presentation to end this. So I'm not going to go in detail because we have already discussed. I'm just saying that there was one question also that why we are talking about this committee and why not census. Absolutely. That's what I'm saying. it has to be based on the demographic intelligence had to be based on the latest number, and for which the census need to be conducted as soon as possible. There is a lot of delay. I deal with census in many countries, and so many countries much poorer than us, less abilities and capacities than us. They have conducted census, and we have not been able to do that. Which it like since 1951 we have been doing census regularly. Sorry, 1870s we have been doing census regularly, and so this is a major cause of concern for not only the demographer, but also the local planners and policy makers, because as Abhijit was saying, uh, we need data at the regional level, sub-regional level, district level, and those estimates, population estimations, could be made only if we have latest population data. And as there was a question also, and Professor Acharya mentioned in her answer that the focus could be one-sided because of ideological tint. To avoid that, in this committee, we need to have subject expert, which need to make long-term demographic forecast for the country, region, states, and which could be used for the long-term planning, prospective planning. Again, I'll leave out this because we have discussed different allocation, different areas. Health research, pandemic preparedness. I did some research on these two areas because in last two budgets we extensively discussed it. There was a lot of emphasis in last two budgets, and I wanted to highlight these, that the experience has not been that great. The kind of intent was shown when epidemic hit us, that we will strengthen our surveillance, we will strengthen our research, we will strengthen our pandemic preparedness. Now, because the pandemic is over, we seem to have lost that focus. That focus has to be there. Challenges, as per with these challenges also came in the discussion also, and in different commentaries, which I have seen on the budget, that how we can have universal health coverage. We need to keep focusing on universal health coverage. We need to keep focusing on increasing the allocation for health. Like it's we should not be happy and satisfied with 0.3% expenditure, 1.9%. If the government has committed that we need to have 2.5 till 2025, it should happen. And because we are in Amrit Kal and we are marching towards a Vikasit Bharat, then we need to have 4 or 5% of GDP spent on health. And similarly, allocation has to be on education also, so that we are able to build our human capital. Shortage in health workforce that was discussed, limited opportunity for medical education. And so many students are going outside, when the pandemic happened, and so many students came back from Ukraine. So are we not able to provide better education in our country to more students within our country? They have to go outside. Are they providing better facilities, better courses, better training to our doctors? We need to kind of focus on that. As I said, focus on research and development, and pandemic preparedness has to be more. This point has come out very strongly in the presentation, and I also feel that this gap between the budgetary estimates and revised estimates, it has to be tackled. If we need to understand whether the budget estimates are just vague laudatory statements and the system does not have capacity, we just want to show higher figure in the budget so everybody is happy, or whether there are serious limitations in the ministry at the center and state level and in the system to actually plan for that we need this much budget so that could be allocated against different heads. And then we need to monitor that, and we need to hold people accountable. Why we were not able to spend? If that was that much money was asked by the ministry, then why you were not able to spend that? So we need to take this matter very seriously, because we are talking of health of people, and there is money given to the ministry, and ministry is not able to spend it. This is a neglect, which I think should be tackled by the responsible person, and Parliament accountability has to be there. That when the vote on budget and allocations takes place, somebody needs to hold accountable the responsible minister, and the officials. There has to be long-term vision and plan. And on last 2 points, what I'm thinking, we can discuss it later when we have more time, that we need to have a separate vision plan for health of the people, which could be a long-term 5-year plan, and the budget should be earmarked for those 5 years. And that annual, we need to have milestones, and where we can check our progress against that. So, because year by year, and then we see that, oh, we were not able to do this, we were not able to spend money. I think let's have a longer term plan for the healthy India, and stick to that plan and have budget allocation accordingly. I'll stop here, and thank you from my side to all the panelists for a very lively and very enlightening discussion. Thank you very much.
Thank you so much for having us. It was
Thank you. Thank you, everyone.
I invite IMPRI for a formal thanks. Shweta, you there?
Yes, sir. Yes. Thank you so much. So with the chair's permission, we can go ahead with vote of thanks. Thank you. As we come to end of today's discussion, I, Shweta, researcher at IMPRI, Impact and Policy Research Institute, would like to propose the formal vote of thanks. On behalf of IMPRI, Center for Human Dignity and Development, I would like to thank all of you for attending today's deliberation. A panel discussion on population health and interim union budget 2024 to 25. We are grateful to our chair, Dr. Devender Singh ji, and all of the panelists for the session. Dr. Sachin Gupta ji, who is the lead of state operations at PATH, a global non-profit dedicated to health equity. Mr. Arvind Unni, Professor Sanghmitra Shil Acharya ji, Professor Pradeep K. Panda ji, Mr. Abhijit Mukhopadhyay ji, and Mr. Pradeep K. Panda ji for taking part in the discussion and enlightening us. We thank all of our participants who have raised pertinent questions and actively participated in today's deliberation. We are grateful if you're watching us later on YouTube channel or listening to us on our various podcasts or reading our publications. You may also find more thematic events and book discussions under IMPRI Web Policy Talk series. We hope you continue to join in future to our IMPRI Web Policy Talk and Web Policy Learning. Wishing you a good evening. Thank you.
Thank you. Thank you so much.
Thank you.
Thank you, everyone.
Thank you. Bye-bye.
Yeah, thank you. Bye.
It was great connecting with everyone. Have a good night.
Devender,
Ah.
send me your phone number wherever you are.
I will send you.
Thank you so much for bringing me on board. Thank you. Thank you, everybody, for your comments.
Thank you, everyone. Bye.
Maybe IMPRI can share everybody's coordinates with everyone to stay connected, I guess.
Sure, sir. I will ask for your number in the email.
Anytime. No worries.
Good night.
Thank you.
Thank you. Bye-bye.
Thank you.